In modern life, we often pay attention to health through obvious symptoms such as pain, discomfort, or fatigue. However, there is a fact that few people notice. The liver, one of the most important organs in the body, does not have pain-sensory nerves at the site. This means that even when the liver is severely damaged or even develops into cancer, it is still very difficult for patients to detect it early. Dr. Pan Zhanhe, deputy head of the oncology department at Zhongshan Hospital, Xiamen University, China, emphasized, the liver plays many essential roles, such as detoxification, metabolism, nutrient storage, and bile production. But precisely because it shoulders such a huge workload, the liver is prone to damage. When the liver has problems, the body reflects it through various parts, including the hands, which few people pay attention to but contain many abnormal signals. Imagine, just by observing your hands daily, you can detect early risks of liver diseases, even liver cancer. In this article, we will delve into 5 characteristic signs on the hands that can reflect liver conditions, so you can promptly seek medical examination and protect your health. 1. Unusual redness of the palms. A warning that the liver is crying for help. In healthy people, the palms usually have a light pink color, with an even tone and not too prominent. However, if one day you notice your palms are bright red without heavy exercise, high temperature, or skin irritation, this could be an early sign of liver disease. In medicine, this condition is called liver palms, liver palm or palmar erythema. It occurs when liver function declines, disrupting hormonal balance and causing small blood vessels under the skin to dilate. Not only the palms, sometimes the fingers also turn red and feel slightly warm. A special feature is that these red spots can temporarily disappear when pressing firmly on the skin, then reappear afterward. Many clinical studies show that up to 25% of cirrhosis patients experience reddened palms. If you see this symptom appearing symmetrically on both hands, accompanied by a mild warm sensation, do not be subjective. This is a warning that your liver may be chronically damaged, even progressing to cirrhosis. Early medical examination will help identify the cause and intervene promptly. 2. Spoon-shaped nails, a sign of iron absorption disorder due to liver disease. A rather special sign that few people notice is spoon-shaped nails, koilonychia. In this state, the nails become softer. The surface is concave instead of naturally curved, forming a shape like a small spoon. The concave area can even hold a drop of water. According to doctors, this is a manifestation of hemochromatosis, a dangerous disorder related to the liver, causing the body to absorb too much iron from food. When iron accumulates excessively in the liver, heart, and pancreas, it causes severe damage and leads to complications such as cirrhosis, liver failure, diabetes, and cardiovascular disease. The worrying thing is that hemochromatosis often progresses silently. Therefore, spoon-shaped nails can be considered an important alarm signal that you should not ignore. If you notice this abnormal nail change, go to the hospital to check liver function and blood iron tests as soon as possible. Besides liver-related causes, spoon-shaped nails can also occur in people with hypothyroidism or chronic heart disease. However, when accompanied by other liver disease symptoms, this is almost a typical sign. 3. Abnormal hand tremors, a manifestation of hepatic encephalopathy. Have you ever experienced repeated hand tremors without a clear cause, even at a young age? Many people often think this is just normal muscle tremor due to fatigue, but in fact, this can be a symptom of severe liver disease. This phenomenon is medically called asterixis, or hepatic encephalopathy syndrome. It is a neurological condition that occurs when the liver loses the ability to filter toxins from the blood. These toxins then travel to the brain, impairing neurological function and affecting motor control. Patients often show jerky tremors in the hands and wrists, sometimes accompanied by drowsiness and decreased concentration. Studies show that up to 70% of cirrhosis patients experience hepatic encephalopathy. The scary thing is that if not detected and treated promptly, this syndrome can lead to hepatic coma, a life-threatening condition. Therefore, if you or your relatives have prolonged abnormal hand tremors, consider it an urgent warning signal from the liver. 4. Clubbing fingers. When the liver is severely damaged, clubbing fingers are well known in patients with chronic cardiopulmonary diseases. However, it is also an important symptom in severe liver diseases, especially chronic cirrhosis or liver cancer caused by alcohol. The easily recognizable feature is the abnormal swelling of the fingertips, nails curving downward, shiny and soft. When touched, they often feel warmer and redder than normal. The mechanism of clubbing fingers is related to prolonged oxygen deficiency and chronic metabolic disorders in the body, with liver damage being a key factor. If you notice clearly deformed fingers, especially when accompanied by other liver symptoms such as jaundice, weight loss, loss of appetite, you need to see a doctor immediately. This usually indicates an advanced stage of liver disease that should not be taken lightly. 5. Pale white nails, a sign of long-term cirrhosis. In healthy people, nails have a light pink color, indicating good blood circulation. Conversely, if nails become paler and even completely white, it is very likely that your liver is seriously troubled. Medically, this phenomenon is called Terry's nails. It is often seen in patients with long-term cirrhosis, especially when the disease has progressed severely. Besides being pale white, nails may also be thin, weak, and brittle. Patients often have accompanying symptoms such as jaundice, yellow eyes, itchy skin, and dark urine. Not only liver disease, Terry's nails also appear in some cases of heart failure, kidney failure, and diabetes. However, in the context of liver disease, this is an early warning sign that requires special attention. Other systemic signs of liver disease, besides the 5 clear signs on the hands, liver disease also reveals many other clues on the body. Jaundice, yellow eyes, due to bilirubin accumulation in the blood. Itchy skin, especially at night, due to bile salt accumulation. Dark urine, pale stools, signs of bile obstruction. Loss of appetite, fatigue, rapid weight loss, due to metabolic disorders. Pain or discomfort in the right upper abdomen. When the liver is enlarged or has a tumor pressing, these symptoms, when accompanied by abnormalities in the hands, further strengthen suspicion of liver disease and require immediate specialist examination. The liver is the body's silent factory, quietly working nonstop to detoxify, metabolize, and sustain life. But precisely because of this silence, liver disease is often difficult to detect early. The hands, seemingly only associated with daily labor and activities, can become a mirror reflecting the health status of the liver. Red palms, deformed nails, abnormal hand tremors, or clubbing fingers, all are signs you must never ignore. If you notice any of these signs, what you need to do is not to be subjective or self-diagnose, but to go immediately to a medical facility for examination and liver function tests. Early detection is the golden key to effective treatment and preventing dangerous complications such as cirrhosis or liver cancer. You are watching the Everyday Life channel, where useful, simple, but essential health knowledge is shared to protect yourself and your family. Please subscribe to the channel and turn on notifications so you don't miss upcoming videos. Wishing you success and good health. See you in the next videos.